While employers are beginning to gain a general understanding of the Affordable Care Act, technical issues and employer-specific needs require an analysis that is thorough and in-depth. A recent survey from the International Foundation of Employee Benefit Plans found that only 16% of employers felt they had an excellent understanding of the law. Depending on the industry, costs associated with the Affordable Care Act can vary significantly. In 2013, the Fedeli Group evaluated a cross-section of clients to assess the immediate financial impact of new regulations. These situational assessments found that up to 75% of employers will have projected cost increases in the range of 1.5% to 4.5% in 2014. The remaining 25% of employers will face cost increases of 10% or more in order to comply with the law. These costs are separate from underlying healthcare trends. Industries that fared the best were financial services, legal services, and business services. Not surprisingly, those that fared the worst were in the retail, restaurant, and hospitality industries. The range of issues facing employers varies from regulatory compliance, new underwriting rules, employment relationships, and eligibility. A situational assessment is an important first step that helps you be prepared for the future while being in compliance with the law today. The shared responsibility requirements of the Affordable Care Act, IRS Code Section 4980H, are effective on January 1, 2014. However, on July 2, 2013, the Treasury Department announced that enforcement of these provisions will be delayed until 2015. This surprise announcement may grant a temporary reprieve, but employers need to realize that the law has not changed. The Fedeli Group will work with you to assess each and every regulatory detail. This includes affordability. Is a single premium for any of your employees less than or equal to 9.5% of their W-2 income? Minimum value. Does your health plan cover 60% or more of the total cost of health benefits? Automatic enrollment is a 2015 issue that could have a significant impact as to how you hire and enroll employees. Review employment relationships. You may need to extend coverage to employees who were previously not eligible. Have you adequately addressed full-time, part-time, seasonal, and variable hour employment issues? New plan fees and taxes are significant. Have you calculated the true cost impact? The reinsurance assessment fee applies to fully insured and self-funded health plans. This fee is designed to compensate insurers for adding high-risk individuals to insurance risk pools. The PCORI fee applies to fully insured and self-funded plans. This fee funds research on the effectiveness, risks, and benefits of medical treatments and services. Insurer fee will be bundled into health insurance premiums. This fee is designed to fund health exchange subsidies and Medicaid expansion. The Cadillac tax is applied to plans with self-only premiums above $10,000 and family premiums above $27,000. This 40% excise tax starts in 2018. In coming years, Medicaid and other state programs will have a significant impact to the healthcare system. The Affordable Care Act mandates the formation of health insurance exchanges. Less than half the states are building their own exchange. Instead, they will rely on the federal exchange. The state of Ohio has opted into a federal exchange but will retain some plan management. As with health insurance exchanges, fewer than half of the states have elected to expand Medicaid. It remains uncertain as to which direction Ohio will take. Employers with multi-state operations that include lower-wage workers will need to evaluate Medicaid on a state-by-state basis. Workers who are eligible for Medicaid are not included in shared responsibility requirements. Contribution modeling. The Fedeli Group situational assessment includes contribution modeling in which premium contribution scenarios are evaluated to determine the best mix between providing affordable coverage and minimizing potential health exchange penalties. Have you done a thorough financial analysis? Failure to comply with the Affordable Care Act can have serious financial consequences. A formalized situational assessment will provide best path guidance while validating decisions in a complex regulatory environment. Contact the Fedeli Group to arrange a situational assessment.